I'm Dr. Marisa Weiss. I, like many of you, know what it feels like to hear those earth-shattering words, "You have breast cancer." Despite all the medical training, years of helping patients, and the deep knowledge about the disease, I, along with our other guests this evening, felt our own lives come to a screeching halt when we got that call. For me, it was 14 years ago. That's when I was diagnosed with breast cancer and became what I call a dual citizen, both a doctor and a patient. And even with my professional background, it took a lot of time, planning, and careful evaluation to process everything I had to go to. I was lucky to receive the best care possible, but there were still major gaps. We have walked in your shoes, and that's why we are here today to support you by sharing what we've learned along the way. I'm thrilled to be joined by Dr. Michele Ley, Dr. Pamela Munster, and Dr. Rachel Swart. Dr. Ley is a board-certified breast surgical oncologist and the founder of Tucson Breast Health Specialists. She's a former director of breast surgery in the University of Arizona Health Network. Dr. Munster is the director of the Early Phase Clinical Trials Unit, co-leader of the Center for BRCA Research, co-leader of the Molecular Oncology Program, and a professor in the Department of Medicine at the University of California, San Francisco, UCSF. Dr. Swart leads the Breast Cancer Clinical Trials Program for the Tucson Division of Arizona Oncology, as well as the High-Risk Breast Cancer Clinic. Her clinical focus is on helping women with a specialty in breast cancer. I'm looking forward to talking with you all about a transformative chapter in each of our lives that changed how we see ourselves as people and as doctors. Whether you're newly diagnosed, in treatment, managing survivorship care, or supporting a loved one, we hope today's webinar helps you feel more empowered. When you registered, some of you told us things that you'd like to hear more about, like how to advocate for yourself, especially when you've read reliable research and have an informed opinion about what you think would work best for you. Also, how to choose a medical oncologist, surgical oncologist, and radiation oncologist, as well as any other member of your team. When to look for a new doctor or get a second opinion. How to improve communication with your doctor and build a good relationship. What to expect after treatment ends and how to reduce your risk of recurrence. Plus, you asked about tips on how to make your lifestyle as healthy as possible through treatment as well as afterwards. These are all important topics that we'll discuss in a bit. Often fear and stress can make us doubt the treatments we're receiving or the doctors who are taking care of us, especially if something doesn't go right or something happens that's not what you expected. We wanted to know whether your voice is being heard and your preferences are being taken into consideration during your care. These are factors that can contribute to a good relationship with your doctors or one that doesn't work out as well, and also how to hang on to a positive outlook as you navigate your way through this jungle of the experience of having breast cancer. So during the registration, we asked you guys, are you satisfied with how well you and your doctors collaborate when making treatment decisions? And as you can see here, about half of you said yes, you collaborate well with your doctors on decisions. About 29% said you weren't sure about that. And 20% said no, you wish you had more discussions with your doctor before a treatment recommendation was made. So what does this tell us? Well, we're moving in the right direction, but there's a lot of room for improvement. Like I said, I had the best care possible, but there were still major gaps. And becoming an empowered patient is key, whether you're a medical professional dealing with breast cancer or someone who is hearing the cancer vocabulary words, all those that mumbo jumbo that we hear as we move through our diagnosis and treatment, if you're hearing it for the first time. The bottom line is that it's your life is precious, You deserve the best care possible. And one thing we've all learned, you have to be your most powerful advocate. The desire for personalized and attentive care was evident in the powerful statements that many of you gave when you registered. For example, someone said, I want to be treated like a person, not a medical chart or a statistic. Someone else said, how do I negotiate my way through various treatments and life decisions when there's so much information and differing opinions all coming at me at the same time? Another person said, why is almost everyone left out to dry once they finish treatment? There was not a lot of emphasis on mental health, but we are not the same people we were before cancer, that person said. Now it's my pleasure to introduce Dr. Michele Ley, Dr. Pamela Munster, and Dr. Rachel Swart. Welcome, welcome, and thank you all for being with us here today and for the generosity that you have to share your own story. We'll be answering questions that everyone submitted when they registered, and we'll try to answer more questions live for everyone using the QA section at the bottom of the screen. And we encourage you to put your questions in there, and we'll get to as many as we can. Dr. Ley, I'd love to start by having you share briefly about your story, when you were diagnosed, what happened in your life at that time, and what your experience was.
Thank you so much for having me participate today. So I was diagnosed 8 years ago. I was diagnosed on my daughter's 5th birthday, sadly. I had a screening mammogram, which was normal, but I had felt something. So I had an ultrasound that was also nothing. But I remember thinking while the radiologist was doing the ultrasound that my breast tissue looked denser than I thought it was. And then I had a new version of a risk evaluation software that I'd put on my computer. So I thought, well, I'll just do my risk calculator to make sure it's working. And my risk was higher than I thought it was. So I ended up getting an MRI. And so all within the space of about a month or so, all those things happened. And I ended up having a cancer on the MRI. Then I had a biopsy, and then I got the pathology. The pathologist called me, which is a little bit different. Being a physician, you can get your results directly from your colleagues, which, has its pluses and minuses. But he called me on my daughter's birthday to say that it was breast cancer. So then my husband was remembering yesterday when I told him I was doing this today. He was remembering that I freaked out. But it's funny, in retrospect, I don't remember feeling that way, but I guess I must have.
What did you do? What does freaked out mean? Like, how did that manifest itself?
Well, I think I was at work, but I was finished with work and I drove right to his office and I started crying and telling him about it. So I guess I did from his perspective. And also, your spouse or your family doesn't know how to react either. They're just as scared as you are. So anyways, I end up choosing to have a double mastectomy, and partly for privacy reasons, probably mostly for privacy reasons, I ended up going to another city for my treatment. I had like a strange sense of being ashamed of having the diagnosis. And so I didn't really want to talk about it. And I didn't want it to, I was only in a new job for about 8 months. And so I didn't want it to affect all that. So I had to drive 2 hours for all my appointments and surgery. And for one of my surgeries, my husband couldn't even come. It had to get rescheduled. So a friend had to take me. So anyways, I had the double mastectomy, and it turned out I didn't need to do any other therapy. Some therapy was recommended, but I went to see multiple people, including Dr. Swart. And in the end, I decided that the side effects outweighed the benefits for the additional therapy for me. And so I didn't do any other therapy. I think that's one of the challenges of being a physician with breast cancer who takes care of breast cancer patients, is patients always often ask me about what therapies I had. And for a long time, I didn't talk about my breast cancer at work, probably for several years.
In my office, patients of mine were calling up my secretaries and saying, like, I need to know what she did, because
right.
they were so persistent, and we had to sort of write a script so everyone would answer in the same way and protect my privacy and let me, give me the space to, manage the process.
Yeah, I think that it's something actually I've talked with some other surgeon survivors that it's hard to, you don't want to disclose it and have it affect the patient's decision making because we're all unique. Our cancers are different, our life situations are different. What treatments are available sometimes are different. So it's always a struggle, but I think it's best to let people know about it. But you can also say, I just like you, I want to have privacy too. So I don't always share all the treatment
Right,
details with people.
right. Well, thank you for sharing all that. I'm going to ask Dr. Munster if you can tell us a little bit about your story.
I remember going after a while because there was this debate, like, do you have a mammogram between 40 and 50? And like Californians are not that keen on doing early mammograms, and I decided to do a mammograms. And then I remember being at the conference and the radiologist called me. You know how you get hundreds of calls from radiologists and you think like, okay, what poor person is now having a bad diagnosis that I have to call later. And I remember she called me by my first name. And usually people are kind of differential and call you with the last name. And I go like, this woman kept going like, Pamela, I have some bad news for you. And I go like, yeah, who's it for? And then she said, well, it's for you. Your mammogram is really looking bad. And so it was the first time it sort of like dawned on me that I've crossed from a provider, getting results from exams for someone else to getting results for me. And it was just so this very first incident where it became very personal. This is about me now. And so like Michelle, I ended up in a situation where I had to have a double mastectomy. I had no family history of breast cancer. I looked at my pathology and just looked like really unusual for a regular breast cancer. So I talked to a pathologist and I said, like, this looks like a BRCA2 related cancer. So then I decided to go and pursue BRCA testing. And of course, at that time, this was 12 years ago, I wasn't really a candidate. I didn't have any family histories. Like, no one in my family had really breast cancer. It just didn't seem that I would qualify. And I ultimately, I did the BRCA testing and turned out to be BRCA2 positive. So in 1 year, I ended up with 3 surgeries. I had a double mastectomy, I had reconstruction, then I had my ovaries out. And the two things that really stuck with me that year, like how hard it is to wait for results. So if you ask me in a nutshell, what did I learn from going from a doctor doing a patient is like, tell patients realistically when the results come back and not tell them like you get the result as soon as possible when it's 2 weeks, because then you wait every day, you wait. So that was hard. And the other thing is like, I remember when I had my oophorectomy, my chance by statistics, that I could have a 3% chance of an occult ovarian cancer. And as a doctor, that always seemed very, very low. As a patient, those 3% my 3% seemed very, very high. I was a wreck until I learned that I didn't have ovarian cancer. But I think, that reassurance that we so lightly give to patients, yeah, you're going to be fine. I stopped doing this because we can't provide a reassurance until we have a test result. I think so. Like, I now would use words like, whatever we find, we'll tackle this, rather than you'll be fine, don't worry about it. I think don't worry about it when patients really worry about everything is like, it's really not helpful. So
Right. They call that positive toxicity, right? Where, and as a patient, you want to, you're growing this relationship with a doctor and you want to be able to trust what they're saying and know that when they're reassuring you that it's based on real solid information. So, I do the same thing you do. I always say to people, no matter what we find, we can do something about it, but we need to really know what we're up against, the extent and nature of the problem before we can really come up with a treatment plan for you. those words matter so much. And I think that's one thing I learned in my experience, is that all the words matter. I remember one of my colleagues said to me, after my mammogram showed a problem, she said, yeah, I was in the radiology department. I looked over and I saw your mammogram on the screen. I thought, oh my God, that's a big ugly thing on that mammogram, the word ugly. And I know radiologists use that word, but it's painful to hear that if it's your own situation, and it just sounds scary, and it's not necessary to use words like that. You could describe it in other ways that are actually more precise and meaningful and help guide the plan. So yeah, I'm going to ask Dr. Swart, how about your story and when you got that call or you went through your diagnosis?
So I was diagnosed, actually it'd be 5 years this October was my diagnosis. I actually received it when I was in clinic giving someone else, unfortunately, bad news. So getting into doctor mode, it was all focused on the patient and really didn't spend a lot of time focusing on myself, even though the realization of what was occurring is like, okay, well, I have to take care of this. And it was more along the lines of, okay, here's my job and I've got to get it done. Luckily, we have excellent breast surgeons such as Dr. Ley, and she was my breast surgeon. I did have a high risk with family history. My mother's a 2-time breast cancer survivor. My aunt died of ovarian cancer, but we do not have a BRCA gene. So I decided to do a bilateral mastectomy, which was kind of good because first there was one spot, and then I did a breast MRI, and then there was 3 spots. And then we did the surgery, and there was 3 spots and a positive lymph node by the time I got done. So it was kind of this gradual, I think I know what I have. I think I know what I have. And then there's more, and then more, and then more. And luckily, with ER positive breast cancer, the Oncotype DX testing that was done on my cancers came back as being low. The medical oncologist, who was a colleague of mine, because I was young, wanted to give me chemo. And one of the Oncotype DX responder data had not come out yet in regards to lymph node positive, but I was already postmenopausal. So I decided, no, I think this data is going to be positive. So I'm going to not do the chemotherapy and proceed with just anti-estrogen therapy, which I'm glad I opted to do because I had several complications related to my reconstructive surgery, which resulted in 6 surgeries ultimately, with my last one being about a year and a half ago, which was the final surgery that helped to make a huge difference in my overall quality of life. And it's been a very long road. I would say the biggest thing that I have learned is it is very lonely. And unfortunately, I got breast cancer and had all these complications during COVID, which even made it more lonely. And so that was something that I think I've learned, is to make sure that my patients realize that there's someone always in their corner that will be there to be their advocate, to listen, because I just remember needing a lot of that myself. But during the time that was occurring, it just wasn't available as much as I had wanted it to be.
Yeah. Yeah, it stinks. Going through breast cancer stinks. And when you can share that with a patient, they really feel like you kind of understand. Yet each one of you, and myself as well, made, our own set of decisions. We made the best decision at the time to get the best care possible. And whoever's listening, even though you've heard people, describe they've had, bilateral mastectomies, they're, in general across the country, we know that at least half of patients, if not more, may be candidate for keeping your breasts as an alternative to mastectomy. But everyone's situation is different, and you make the best decisions you can at the time. And then you have to live with it, right? That's part of it, is that you have to live with it. And you want to minimize the woulda, coulda, shouldas, that when you look back and think, oh my God, what did I do or what did I not do? Then of course, everyone around you has their own experience that they want to share. And I think it's really interesting how when you're a patient, as well as a doctor, it doesn't really matter that you're a doctor, you experience this whole phenomenon where so many people come at you with these stories, and they're usually bad stories, and they're kind of unloading them on you, and that can sort of make it even harder to go through it. So we've all learned how to figure out where to get the support we need. And for sure at breastcancer.org, that's why so many people come to us at breastcancer.org, is to get the expert answers to their important questions, and then connect with other people in the community so that they're not going through it alone. You guys have, our audience, our community has submitted a lot of really important questions, and I thought I would, hit on some of those right now. One of the questions was, did going through breast cancer change how you care for your patients at this time? We can sort of go through it. Maybe Michele can go first. Like, how did your experience change what you do for the people you have the honor of taking care of?
I think before I was diagnosed, I was already quite empathetic, and I felt like I took my work home a lot in terms of being worried about my patients. And I had a few people say to me, oh, this will make you so much more empathetic for your patients. And I found that was hard for me, because I was like, I didn't really need to have breast cancer to learn how to be empathetic. But what I did learn is about the recovery process. I tried to do my surgery and get back to work as soon as I could. It turned out that year I had forgotten to sign up for short-term disability, so I wasn't getting paid, and I had to pay for my health insurance while I was off. And then I did the place I went to turned out to be out of network, so that was more expensive. And so I tried to get back to work, and I went back after 7 weeks, which is usually what we tell patients. Oh, you can go back to work after 6 weeks. I couldn't open the doors in the hospital. I had this whole system of getting it partway open and my leg in there and my arm to kind of wrestle my way in to the hospital, and like doing things that required me like pushing my hands together or pulling and pushing, which is a lot of what we do in surgery, was very difficult because my muscles were weak. And so I really try to have an in-depth conversation about what people do at work, how stressful their work is, and encourage them. And sometimes if they're not hearing me, try to use my own experience to tell them, like, you really need to take time for yourself, with the understanding that not everybody can financially do that. And then if you're not able to do that, how can we help you get back as soon as we can? What kinds of things can we do to get you back so that you can earn a living? Right. I think the other thing is about the overall health. You think you're diagnosed with breast cancer, you think, oh my God, I'm going to change my diet, I exercise every day, I'm going to be this new person that's never going to get cancer again. It's very difficult to do that. I think we all have very busy lives and lots of commitments. We have lots of commitments to other people, and it's hard if you're in a family or with other people at home. You can't just change your diet, because then then everybody has to change their diet. So I try to encourage people. Yes, I only have 15 minutes at a follow-up visit to tell you how you should change your diet, but that doesn't mean you have to do all of it tomorrow. And to try and give yourself a break, for different things. If you didn't clean your house because you're sick from chemotherapy, it's okay. It'll get clean later. Those are the things I've tried to just give people a break, give yourself a break, and try and also to ask patients, recruit other people around you to help you. I think that's about the loneliness. Even though Dr. Swart and I worked together and, we had our patient-physician relationship, it's really hard to make time to talk to one another. And then you think, well, you don't want to talk about this depressing thing, how we both had cancer, or you don't want to depress your friends or your family members talking about it. But I think people want to help when you're diagnosed. They don't always know how to help. and you don't even have to talk about it. Maybe you just go out to lunch with someone or go for a walk with someone. I know I'm kind of digressing from what you were asking, but like that's part of the recovery process that I don't think I understood until I was through it, that it doesn't just stop the minute you're done with treatment. Like one of the
Right.
quotes you had, like
Yeah.
this is something you carry with you forever. So finding ways to be able to talk about it with people.
Yes,
And for me,
absolutely.
being the person the patient can talk to, like you said, like I want to be the person the patient can come to when they are having an issue that maybe isn't related to their surgery.
Yeah. Right. I mean, I had to go back to work. I felt like I had to go back to work like 2 weeks afterwards. I crawled into the hospital. I really couldn't do much, and it was in such pain, and it was not a good decision. But one thing that I worked for me in terms of cleaning, I didn't clean the house. What I decided was I was going to put cleaning solutions everywhere. So when things that had the perception that my house was clean, because I had products everywhere and I had vacuum cleaners like pulled out of the closets and in rooms so that people could see them everywhere. And I thought that works for me. It wasn't a problem. Okay. Dr. Munster, I'm going to ask you a question. Is there another question that came in? Is there anything to look out for when searching for an oncologist or a surgeon who communicates well with their patients? Like, how do you find that doctor that you can relate to?
You know, that was actually something that I really learned. You know, early in my career, I put this huge pressure on me that I need to be the doctor for everybody. And when I had cancer, I realized there's a whole bunch of people I don't like. There's a bunch of surgeons I don't like, I'd never go to, right? Just because, and they may be super fine surgeons, but they're not my type, or is something I don't mesh with them. It's like, what I realized is like when I was going through this, how much of this is actually a relationship. And you know, like in a marriage, it can be two wonderful people and they have a really bad marriage, right? That doesn't take away. So I think now when I feel like I'm not a good match with the patient, I tell that patient that I think they will be better off with someone else, because the patient doesn't trust me or doesn't have a good relationship. How are they going to ask me intimate questions on how do you think? At the same time, it's like someone leaves me or goes to someone else. I don't take this personally. I just think like patients deserve better. So this is not always that easy, but I often tell my patients now, like, you know, I'm a certain age, I have a set personality. This is not going to change. Like, it's like what you see is what you get. And if that's not your cup of tea, I can't just change my personality within range. But I think an oncology relationship with the patient is usually, for breast cancer, you're looking at 5-10 years of a relationship. You can't do this with someone whom you
Right.
don't.
You can't fake it.
No, it's like I think people just deserve better than
Right.
that. And
Right.
you
You
should be
want to be
honest
yourself.
about this. Yeah. And I think that's an important part. And as of course, like at the same time as like I try to tell patients like how human we are. Like we have good days, we have bad days, like we are hungry, we are cranky, we have families that have issues. Like you know, I think it's a relationship, and the more you can treat this as a relationship with someone who's caring, the more care you give. And I think you need to give a doctor guidance on what you need. Some
Right.
people
Right.
have different needs than others. We are not mind readers, right? I think it's one thing to be open and like yeah, but I think it's really important to see this as a relationship with another human being. And
Yes.
and if you go to lunch with someone, you don't spend the first 10 minutes yelling at them for being 10 minutes late, right? That's not going to make for a good lunch. I think that's like the
Right.
assumption that that a doctor is not late because they're out there doing the nails or chit-chatting around. It's like we usually run late because we help out someone else. So I think it's a
Right.
lot of these things, like
Right.
managing this and trying to see good intent in your physician and in your patient will go a long way.
Absolutely. Absolutely. It definitely is a relationship between two people, but it's all about the care of the person who's being diagnosed. And so you want to make sure that the doctor you have is a good fit, as you were saying. I'm going to ask Dr. Swart the next question. Should patients ask their oncology team up front how best to communicate with a team in between appointments so that you can set your expectations and you can reduce your frustration, and then you can and also show like mutual respect, so you can hopefully get on the right footing.
Well, if your oncologist or your oncology team hasn't told you how to communicate in the visit already, because I do that up front with my patients, because I think if the patients know what the expectation is to begin with, your relationship is only going to get stronger. And if they know this is the best way to get a hold of you, and they have the expectation of, okay, if I go through our portal, which we have an excellent portal that we use, I say, I'm turning around those messages so that you guys are getting some communication within 24 to 48 hours. You know, we even tell mainly our treatment patients, we always tell them, if you are having symptoms, call the office directly, because we've done phone trees and stuff like that throughout the years. And what we have found is that when patients are on chemotherapy and really not feeling well, we need to have people answering phones. So we've gone back to really answering phones for our patients. And that sort of communication just continues to build that relationship that you need, because you are looking at a very long-term relationship with these patients.
Absolutely. You want to be able to feel comfortable, like, you knowing who you're going to call, and then that person's going to answer the phone. That person cares about you.
Yep.
Yeah.
So we do have cards for our triage nurses. We have cards we have for our head nurses, so that everybody that's coming in that's a new patient is actually given a folder with those names of those individuals, and specific numbers as to who they're supposed to call. And so I think that makes a huge difference in patient satisfaction and expectations for our patients.
Absolutely. Absolutely. Dr. Ley, I was going to ask you a question. You know, obviously, you know, having a diagnosis makes you vulnerable, and you're like dependent on people that you don't maybe don't even know, and people are afraid to offend their doctor. So how do you advise people who are nervous about getting a second opinion or even switching a doctor if the fit's not good?
I think this one is interesting because, like Dr. Munster said, I think patients are really, sometimes, you know, they're mad at us because we're late, but a lot of times patients are afraid to offend us and afraid to hurt our feelings. And I have to admit, I have had my feelings hurt when someone wanted to go see somebody else, or, you know, it doesn't seem like it's a good fit. But on the other hand, that pales in comparison to my desire for the patient to have the treatment that they feel like is right for them and the relationship they feel is right for them. I'd much rather have someone, you know, have my feelings hurt a little bit than have them stick with me when it wasn't the right fit. What we do for people depends so much on trust and their faith in the medical system and in science, and their trust that we are there for them. And so if you don't feel like you're trusting us, that, you know, even if we're not aware of it, it injures the relationship and it can harm, you know, the outcomes, I think. So I would much rather have a patient seek another opinion and go somewhere else than stick with me just because, you know, they're afraid. I think sometimes patients ask if they should have a second opinion. That's harder because I'm not inside their head wondering, you know, I don't know why they're asking that. But usually I say that, you know, I can say in my community that the breast surgeons do things pretty similarly. Maybe our cosmetic outcomes might be slightly different, or we might have some nuances. But that's really good. For the most part, we do have that. Sometimes patients, though, aren't necessarily looking for a better fit, you know, emotionally, but sometimes they're looking for an answer that they perceive as the right treatment for them. I guess I've seen this before, that sometimes people want to have a second opinion to see if someone will give them a different answer than the one that they got first.
Right. Yeah. They need to hear it from a different person, or they have any, you know, wrestling with some uncertainty or some question. They just
right.
Yeah. Thank you. Thank you. Dr. Munster, you know, obviously, even with it, you know, even if you do get the best care, we all need to learn how to speak up for ourselves. Since it's our life that's at stake. What's your advice for how best to speak up when you feel like intimidated or rushed, or someone was dismissive with you?
I think, you know, there are people that are like naturally more confident than others and feel like they're just more empowered. And I think often what I find really helpful is if you bring a friend who asks. So I can tell you, like, when I went through my plastic surgery visit, I come across as very confident, and I always talk a good game, but I was completely freaked out. Every time the surgeon talked about this cutting, making an incision, my mind was wandering off, and I swear I didn't hear anything what he said. So I sat through a full hour of conversation with the surgeon, no idea what he's going to do. And then I went to my nurse and said, like, can you go with me for the next visit? Because frankly, I get so freaked out when someone wants to take a knife to my chest that I can't hear anymore. So the nurse made me write a 10 bullet, like what I want to know. And then she read them and asked. And I swear, anyone who knows me would never dream of that I would actually have anxiety of asking anyone a question, but you get really worked up. So I think it's easier to bring someone else, go with someone. It's a lot harder for a physician to dismiss a couple, a friend, spouse, or anyone, than dismiss an individual. As an individual, you may sit there, forget your questions, whereas the person who's there with you taking notes may say, like, hey, but by the way, you wanted to ask this question. Do you feel like you have a good answer? It's just bring a friend.
Right. And just having the ratio, like sometimes when you go to see your doctor, there's just little old you, and then all of a sudden the door opens and all these people come in, the team comes in, and you feel outnumbered.
Mm-hmm.
So if you do have someone else with you, you just feel like a little bit more confident that you feel like you've got your team there too, and it's not just little old you. That makes a difference. Dr. Swart, I was going to ask you a question about just like practical tips for preparing for appointments. Like, what do you personally do ahead of time when you meet with your doctor, that other people can learn from you? Like, how do you prepare for that visit?
I have to write down my questions. I'll tell you, the anti-estrogen therapy has really been one of those things that does affect the memory over time. And so anytime I'm looking at, okay, what about this particular thing? Or am I thinking about, how long do I want to be on my anti-estrogen therapy? What's the new data on that? What should I really be testing? What new tests are out there? I write down those questions. And I encourage my patients also to write down those questions as they're getting new information, as they're looking at different websites and resources, and coming prepared for that appointment so that we can talk about, the new, treatments that are out there, or the new tests that are out there that give us more information on how to treat, breast cancer. So I think really that's the best way to prepare for your appointment. And I think also that I think patients should engage their doctor in answering those questions. I know there are some times that we can get into a situation where the doctor's so busy that the doctor's in and out of the office, and you barely even had a chance to even get one question out. I think patients need to be more proactive in making sure that they understand their diagnosis, they understand the treatment plan, and they make sure that their questions are being answered successfully. And it may not necessarily be by the doctor sometimes. We all are rushed. There's a variety of different patients that do need to be taken care of, but it's also making sure that my social worker or my navigator is also engaging with the patient, and maybe they're the ones that are helping to answer some of those questions as well. So making sure that you have those resources set up, I think, are very important.
Yeah, right. Absolutely. And like you want to ask the right doctor for the right question. So for example, if you have a question about surgery or plastic surgery, you want to ask the right surgeon for that. Or if it's a question about anti-estrogen therapy, you want to ask your medical oncologist who's got the most expertise in that area. And it's good to let the doctor know up before you get there, let the nurse know ahead of time that you do have a number of questions. And as you say, preparing for everything, like your visit with your doctor, or, laying out the clothes you're going to wear the next day, whatever you can do to sort of a gift to yourself to help yourself take care of yourself and help yourself get the best care with the most confidence, like you're wearing what you want and you're it gives you more control over everything, and it's just you're taking care of yourself and you're helping yourself get the best care possible from other people as well. And that can make a big difference. Also, if you don't have all the answers to your questions, you can make a plan like, I've got additional questions. I know you're busy today, but can we set up another appointment, or could it be a telemedicine visit, or can I email them to you, or can I speak to your nurse? Or are there questions that I have on this list that I would bet I could get the best answer from another person on your team? And it's always makes sense to put the most important questions at the top in case you don't have a lot of time and you want to make sure your most important questions are answered before the doctor slips out the door.
That is true. Yes.
Yeah. Well, I have you, Dr. Swart. Many of us have struggled with like significant side effects from medications, like you were saying that you dealt with it. I was on anti-estrogen therapy myself. And while we know that our treatment can save our lives, we also need to have, protect our quality of life. So what do you do when you feel like you've hit your limit and you need a new plan? Like, how do you advise your patients on how to manage that kind of like, conflict, and that making a decision after you made your decision, you thought, I got my plan, and you're executing your plan, but then when you get started on it, you're not getting along so well, and you want to reevaluate. How do you do that with your patients?
Well, that's a hard question, because there's a lot of processes as far as the plan, and the plan can change based on side effects you're having with the medication, based on the new data that's coming out, based on new testing systems that we have to determine how long people should even be on anti-estrogen therapy. Myself, one of the biggest things is I'm coming up on 5 years. I've got to make a decision for myself. Am I going to endure another 5 years of anti-estrogen therapy? And that's a really tough question. I don't think I've even in my own mind determined, based on the data I know as a medical oncologist, how I'm wishing to proceed. I think that's a very difficult decision to have with a patient. And I think that's where the medical oncologist really has to take the time and sit down and go through the risk profile for people, the quality of life. What side effects are you continually having on AI therapy? And I think ultimately I have found that if I can have a good relationship with my patient and manage their side effects and really focus in on how do we address your quality of life so that we can keep you on your medication, those patients do really well, and they're highly motivated to stay on their medication because they know it's important for their life.
Right.
And so I personally have a very strict regimen that I try to stick to in order to minimize my anti-estrogen side effects. So I'm a big exercise person. I stick to a very clear diet, to keep myself healthy, try and keep to a good regimen of sleeping, although even sometimes that doesn't necessarily work. I have tried different supplements over the years. I've seen functional medicine doctors to actually determine different things that I can do in conjunction with my anti-estrogen therapy so that I can continue to get the treatment that I feel is most beneficial. So I've tested a lot of waters out there trying to stay on my estrogen therapy.
Yeah. It's tough. I mean, it's a big job to do, and it's a lot of work, and it requires a really big commitment. Because it can mess things up, how you function, how you feel, your energy level, how much you're sleeping, your sexual life, the way your hair looks, everything, of course, a lot of people, you said AI, you mean aromatase inhibitors, the medicines that can make you feel like a little old lady, and how do you manage all that? Dr. Munster, you went through not just your breast surgery, but because of your inherited genetic mutation, you also decided to have your ovaries and fallopian tubes out. So you went through major changes in a really short period of time. And so, and for you, the same question, like, when you put yourself through so many big steps, all with the goal of saving your life and protecting your life so you can move forward and be to a safer place. But how did you, if when you hit a limit, how did you navigate through that limit and sort of have, manage side effects or whatever else that you went through?
I think I have to say, like, I was not prepared how emotionally difficult it was to lose my breasts. I never was a breast person. Never thought it was really that big a deal, but I was completely unprepared how emotionally raw I was for about a year and a half after that. And I hit pretty low points. And at some point I was thinking like, I just want to do a Thelma and Louise and go over an edge. And I was then reminding myself that I just went through 3 major surgery to keep myself alive, that it would be very unreasonable to not want to live. But and I now warn all my patients. So for about a year and a half, it's like I feel like, and it happens to a lot more than just me. It's like your more immortality is robbed of you in a sort of like very hard to explain way, and like everything is just, your bottom just falls out. And then how this comes, it goes away. Like I don't know why 18 months into this, I all of a sudden felt better, but I think this is the hard part. And what I think I want to go back a little bit and speak to the loneliness. I remember like walking into the hospital, like, and we had this long hall with all the physicians' offices, and I would read all their names, and I would just not feel part of them anymore. I just felt like now I'm someone different. I'm with a cancer. Like I don't have the guarantee that I'm gonna grow old. And it was, as I said, I was very, very unprepared for that. It's like I was just completely unprepared for having cancer. And I'm sure there's no good preparation for having cancer, but I was very, very much struggling with this whole concept. And then I feel a little bit the worst is as you go through treatment, all your friends are rallying around you, right? And then you're done with treatment and the people just move on. But and everyone thinks like, oh, you're fine now, you're done, right? You're found. But you still with this, it's a little bit like when you have a sort of like a near miss with a car accident, how like for hours later you envision that crash
Rattle,
doesn't
yeah.
happen, right? It's like I think that happens with cancer. And I think the loneliness in this, and as I said, like I was thinking to myself, like, how can I have been a physician for so many years and not be aware of that? But it's
Right.
that
I
was
mean,
very striking. It's like
yeah. I mean, that's one of the things at breastcancer.org that we're struck by, because we have this enormous community of people, 12 million people that, connect with each other through our community discussion boards and through the meetups. And they're like, starving, to connect with someone that can hear them, see them, feel them, know what they're experiencing, and they don't get like a dismissive, like, you'll be okay kind of answer. And I remember like I had a number of pity parties that only I was at. I didn't really want to drag anyone else into it, but I have to say that at my work and at breastcancer.org, everyone was like incredibly supportive and helped me with communications, because they're all the talking to everybody and explaining everything, and was exhausting. But you just have to sort of make your way through it. When I went through it, I had my 3 kids were a little bit older in college. And Michele, I was going to ask you how you managed with your daughter. You said she was 5 at your diagnosis, and how's that played out? And I'll ask another question after that.
I wanted to, yes. So she and I haven't talked very much about it, because at 5, she was a bit young, I thought, and to kind of, how do you describe that? And since I didn't look a lot different physically, I didn't want to talk about it either, but I have a son who's 5 years older than her. So he was 10. So, we went to lunch one day and I explained, what was happening and what was going to happen, and that I was going to be fine. But I think that's what Dr. Munster said about losing your immortality. That was one of the hard, I actually kind of forgot about it because it's been 8 years, but actually it's true. truth, if I was really honest with myself, I haven't forgotten about it. It did take me a year to get used to how my body felt afterwards. It was almost a year to the day from my surgery that I was like, oh, now I don't notice the changes anymore today. And then the psychological changes I had became very depressed because I thought initially I was going to take some of the anti-hormonal medicine. So I abruptly stopped an antidepressant I was on. So I became depressed and I couldn't find someone to help me. So I ended up having to go back to another town 2 hours away to get treatment for that. And then you don't want your patients to know that you're vulnerable because you don't want them to think that you're not capable of taking care of them. And I had another physician tell me that when I was diagnosed, don't talk about it with your patients because they'll use it against you. So all those kind of fears. But I think the main immortality, like my husband, and he was scared, of course, but he could not understand, naturally, he couldn't understand that feeling that like, oh my God, I could die from this someday. And I think that's very hard for someone who hasn't experienced it, whether they're your family or your friend, to grasp really what that feels like.
Yeah.
And now it's translated. When I turned 50 2 years ago, I started worrying about something else. My dad had cancer and he died at 64. And so I started thinking, oh, maybe I only have 14 years left. And I don't think if I hadn't had cancer at a younger age, I'm not sure I would have thought that when I turned 50. I don't
Wow.
like
So
it just kind of colors how like some one of your quotes, I think, and a couple of the people have said, like, it just changes who you are, hopefully for the better and hopefully not for anxiety provoking all the time. But that is one thing that is different for me, that I do talk to patients about that sometimes, because we forget to ask patients about their mental state.
I was going to ask you, each one of you, I like a minute each, if you could tell me, like, in your everyday, what do you do to try to be as healthy as you can be in your everyday? Like, what do you stick to? What works for you? Like, eating, exercise, whatever it is. Michele, Dr. Ley, why don't you start off while you're here?
I like to, I'm trying to eat more vegetables. That has been my goal for the last couple of years, get more vegetables on my plate. And I've become a fan of trying to find new recipes on Pinterest. I don't really do all the TikTok and everything, but, and then I share the recipes with my patients. I haven't quite formalized that yet, but I'm hoping to have a recipe of the week for people. Cause I think that's something simple that we can all do. And if I can model it myself by doing it for myself, and then that's what I do. My goal would be to do more yoga, but that doesn't always happen. But that's something else that I like to do for my health.
Well, and for your practice too, just to be limber and range of motion.
Yes.
That stuff. That's great. How about you, Dr. Munster? And your everyday, like, what do you make sure to do to try to stay as healthy as you can be in the everyday?
So I actually looked at it a bit from a different. So I was always really ambitious and very driven and and probably a little bit too ambitious and too driven and too peer oriented. And a friend of mine just during breast cancer said, like, be kind to yourself. Don't forget to be kind to yourself. And now I'm just a lot nicer to myself. Hopefully I'm nicer to others, but I'm a lot nicer to myself. I love it. I exercise and diet. This is sort of like, I love to do this. So this is not a hardship for me. But I don't force myself to do all kinds of stuff that I used to do. Is like, I try not to outperform my own demons anymore. I just like to quelch them and try to,
That's a great step and something we can all learn from. How about you, Dr. Swart? What about you? What is a few things that you do in your everyday that you try to stay as healthy, keep you healthy?
Well, exercise has always been a big thing for me. And I rearranged my clinic schedule to really make sure that I kept to a very good exercise program. I would say more recently, last October, I had a scare with a benign brain mass. And so that really kind of triggered me to really start thinking like, how do I change my mindset? Because that had an emotional impact on me. Luckily, I didn't have to have any surgical intervention and we're monitoring, but I think the biggest thing I ended up doing is practicing more gratitude and being more cognizant of, like what Dr. Munster say, being kind to yourself, because I think we are our harshest critics, and we tend not to be mindful of taking care of our own well-being. And so that's really something I'm focusing in
Yeah, that's
on.
great. For so many people, we have like, are trying to manage our weight in our everyday. And I formed a like a text group with friends of mine, but we had one rule, which was no shame. Everyone has to be nice to themselves. Don't be calling yourself a fat pig. Like, just, we're just going to share our weight every day and the things that help us. And actually we were pretty successful. I got to get back to it, but that's the way it is. It's a lot of work in every day to stay as healthy as possible and to sort of, look forward to the good times. And that's what all that hard work is about, is to try to get back to a life that's worth living. And when I was going through it 14 years ago, I was thinking like, oh, maybe one day I'll have a grandchild. Well, finally I have a grandchild and she's almost 2 and I've got 2 more on the way. So I feel like it was worth the battle, but I know a lot of people who are listening are still in a battle, and you just do the best you can in your everyday life as you move forward. So that will be our last question today. I know we have so much more to talk about, but I want to thank you so much to each of you, Dr. Munster, Dr. Ley, and Dr. Swart. You really shared so much, and you were about your personal experience, and I think it really has helped other people who are participating. Before we go, I want to really emphasize that it's your doctor's job and privilege to help you and to understand your unique situation and preferences. And we know that partnerships, this relationship, they benefit from the clear communication and mutual respect, which is why you have the tools and the resources that you need. We want you to have those tools and resources that you'll need to play an active role in your own care. So we encourage you to work with your doctors and nurses to build that relationship that gives you the confidence as you navigate the path you must take after a diagnosis. And we all know it's a lot of work and it stinks, but there are others going through it and you're not alone, even though it can be so lonely as you make your way through it. Empowering people with knowledge and with a supportive community is exactly why I started Breastcancer.org. We're almost 25 years old now. And I want to thank each one of you for being here today and for being part of our community. Thank you so much. We will email you links to useful information, including a recording of today's discussion, as well as a link to register for our July webinar on corrective breast surgery. We hope you can join us then, and we want you to take care of yourself and be nice to yourself, give yourself grace. And we hope to see you again soon. Thank you.